This audio presentation was pre-recorded and edited for brevity and clarity.
Hello, my name is Diana Campbell, and I'm pleased to be here with you for today's Macular Chat, What You Need to Know About Cataracts and Macular Degeneration. This chat is brought to you today by Bright Focus Foundation. Macular degeneration research is one of our programs at Bright Focus. We fund exceptional scientific research worldwide to defeat Alzheimer's disease, macular degeneration, and glaucoma, and we provide expert information on these heartbreaking diseases. You can find much more information on our website, www.brightfocus.org. I am pleased to introduce today's guest speaker, Dr. Emily Chu, who is the Director of the Division of Epidemiology and Clinical Applications at the National Eye Institute, the National Institutes of Health, or the NIH, in Bethesda, Maryland. She is also the Chief of the Clinical Trials Branch in the division. Her research interest includes phase 1 and 2 trials, clinical trials, and epidemiologic studies in retinovascular diseases, such as age-related macular degeneration, diabetic retinopathy, and other ocular diseases. She has worked extensively in large multi-centered trials headed by the staff from her division, including the Early Treatment Diabetic Retinopathy Study, ETDRS, and the Age-Related Eye Disease Study, AREDS, or AREDS, and the AREDS2 study as well, which she chairs. She works on other clinical trials in collaboration with other institutes within the NIH, such as Actions to Control Cardiovascular Risk in Diabetes, or the ACCORD trial, and she chairs the ACCORD Eye Study. She directs the clinical portion of the international study, and I'm going to say this word, I'm going to mispronounce it, Macular Telangiectasia Project. My apologies. Dr. Chu, thanks for joining us today.
Well, that was a great introduction, and thank you for being so generous, Diane. It was great to be here with you. Thank you for having me.
It's a pleasure. Okay, well, let's start with a big thank you to you, actually. On behalf of everyone living with macular degeneration, I want to thank you for dedicating your career to research in this field. Most, if not all, of the people on this call are impacted by macular degeneration and are pretty familiar with the AREDS studies and may take the AREDS2 vitamins. So I wanted to draw for them the connection that you're the chair of that study that is such an impact on their daily life. And we certainly talk about AREDS quite a bit in the same forum on these chats. So thank you so much for your hard work on that and making such a difference in the lives of everybody that's listening today. But today we'll talk about another area of your research and the study cataract surgery and the risk of developing late age-related macular degeneration. Before we get to the details and results of the study, let's start off by explaining what a cataract is and how it affects our vision. We'll kind of start from the beginning.
Sure, that's a good way to start. I'll give you a very short anatomy class 101, very basic. You know, when we look at someone's eye, you can see the sort of clear part, like the cornea, which is like the stopwatch, the clock on your stopwatch, or on your wristwatch, that's nice and clear. And you see the iris, which is different people's different colors. But then behind that is a little lens, which is quite clear. It's like a lent, it's like a lenticle shape, and it's like very, very clear. And during lifetime, it changes over time. Remember, when you're very young, you could read up close to your nose, and then as you get older, your arms are not long enough. You have what we call presbyopia because your cataract is being really able to expand and be different refractions where you can actually see up close and far away. But we lose that ability to read as we get older. So that's part of that lens that works on it. But what becomes problematic is when instead of being a clear, thing to go look through, it has impurities and it's got little opacifications that occur. And over time, that can blur your vision. So there are different types of cataract. You can have the straight blurring of vision occurs, or there's a type that occurs when you're driving at night. When you're driving at night, your pupil gets very large because it's somewhat dark, and it gets into the area where you have impurities in the peripheral part of the lens, and you get these really glare, and you have difficulties driving, even though you can see perfectly well. But at nighttime, that may be a problem. So sometimes people get cataract surgery, even though they have good vision, because of the blur from that particular aspect. And finally, you can get cataract that's in what we call the posterior subcapsular in the back of the lens. And that's usually from taking steroids or, that you need, and that affects your reading vision. And if it's right in the center, you're going to have a lot of trouble with reading. So it can affect you in many, many different ways, and different people obviously get it. People with diabetes have an increased risk for having that. People who have taken lots of steroids might also be at risk for that as well. And people can obviously have trauma. They can have some injury to the eye, and that could cause some problems. And smoking is a risk factor. Smoking is never good for you. Not good for your eyes at all, for macular degeneration or cataract, or for your heart or for anything else. So if you can do that, stop smoking. That's really important. And then people have had surgery in their eyes. If they've had glaucoma surgery, or they've had what we call vitrectomy surgery, where we go inside the eye and remove the jelly part of the eye for diabetes or for macular holes or other things, that increases the risk of cataract as well. So those, in a nutshell, are the reasons people get cataracts.
Great, thank you. What are some of the initial symptoms of cataracts that people might be noticing?
So I think one of the things you might notice, it would be blurry vision. It's one of them, and I described the fact one other type of cataract happens when you're in the dark, doing things in the dark, and you, especially when you're driving, because the lights are in your eyes and you get the glare. So that's a different type of cataract. And then you can have just specifically problems with reading. The posterior cataract will cause that sort of problem. And so those are all the different things that relate to cataract. So most people present to their doctor because they can't do the things they want to do, because they either can't read or can't do some things. Driving may be more difficult. So those are the usual symptoms that they come to their doctor, who then examine them, find out what the issues are.
Great. So once it has been determined that somebody has cataracts, what is the course of treatment?
Well, the course of treatment, and now we have really great treatment. Cataract surgery is really, really excellent. It's done very quickly. A team does it all the time, and certainly there's no other treatment other than surgical treatment really for removing the cataract. And most patients usually get, depending on the type of cataract you have, and depending, for example, if you're very short-sighted in one eye, in both eyes, then you tend to have to take one eye of a cataract out. You probably do it pretty quickly for the other eye, because there'd be such discrepancies between the two eyes that'd be very hard for your brain to understand. So usually it's surgical removal, which is done by most ophthalmologists who are very good at this, and it's a highly successful treatment. 90% of patients end up with very good vision, or 95%. And few might have a little bit problem because they already have some problems in the eyes. So it's definitely it's surgical. And there are, I think people talk about lasers and stuff, but the laser is done in a different way. But cataract really is surgical removal.
Right, great. So we're going to pivot to the study. In the study that you and your team did a few years ago, you were evaluating if there was a higher risk of developing late AMD after having cataract surgery. Could you walk us through the basics of the study and the results that you and your team found?
Sorry, I have a bit of a cold. Sure, I'd be happy to talk about that. We were interested in looking at that question. And the question is, if you have macular degeneration, what happens if you take your cataract out? Does it make your macular degeneration worse? Because that's the question we ask all the time. Macular degeneration causes half of the blindness in the United States, so it's very common. And cataract's also very common. They're both diseases of people who are aging, and so they're both a process of aging. So does one make it worse? And especially the fact that when you do cataract surgery, you might cause what we call inflammation in the eye, will it increase or increase the risk of macular degeneration progressing. And a few studies in the past have suggested that. And some of the doctors have said, oh, this is so bad, I don't think you should do cataract surgery on anybody with macular degeneration. And we actually looked at that question probably about 15 years ago in our first study, ARIS, and we found no harmful effect. And this is important because people with macular degeneration have compromised vision already. If you can improve them in any way, that's going to be a big bonus for them in any way. So we were very concerned that this may or may not be true again. And so we took the study from our age-related eye disease study 2, ARIS 2, where we followed patients for 10 years. So it's a long time. And a lot of cataracts happen over that period of time, like over 1,000 cataracts happen. And these are people who are at risk for macular degeneration, so it's the perfect place to study them. And we also take good visual cuties. We do visual cuties that are measured, so you know exactly what they're seeing. We know exactly what happens with their macular degeneration, so we can time the two together and see if there is any correlation. And so we took the study from baseline all the way to 10-year, and we found that patients, even though they had macular degeneration, did have cataract surgery done. And guess what? It didn't increase their risk of macular degeneration. We did it in 3 different ways. We looked at matching people with disease and with surgery, and the other eye not having surgery, matching pairs, and we found nothing there. We did 2 other different statistical methodology, and again, we found nothing. Excuse me. And so what we found was that their visual acuity actually, even though they had macular degeneration, that was pretty far on. They still actually improved in their visual acuity. I think part of it now is people, especially with macular degeneration with the wet type, we have good treatment where we do injections of anti-VEGF therapies such as Lucentis, Eylea, many other, Avastin, any more long-term, longer follow-up, and all sorts of ways of delivering it. And that has really reduced the risk of vision loss. We found that it didn't increase the risk of macular degeneration, but these patients are at risk for macular degeneration. If you have macular degeneration, your risk of progressing is always there, no matter what you do with the cataract. So the message is, if you have cataract surgery and you're done well, most times your macular degeneration is taken care of by another doctor. Be sure to have that eye checked out for any progression of disease, because a lot of times you can actually treat it. We now have great treatment for wet form, and there's some treatment for the dried form as well. But the difference is the fact that we actually can really help patients after they've had cataract surgery, despite the fact they have macular degeneration. So we felt pretty good about this, and there were a number of other studies that were looking at this. And interestingly, the first studies, which were studies looking at people living one place like Beaver Dam, or people living in Wisconsin, for example, people living in Australia called Blue Mountains Eye Study, people living in Rotterdam. So all over the world, people have looked at this question, and when they looked at way back when, there should be a risk. The risk might be because cataract surgery has evolved to be much safer, much less traumatic than it was before, and maybe that's why we're getting better vision. And they're now putting intraocular lens, those little implants that you put in instead of having to wear glasses. They insert a lens inside the eye, and those lenses are somewhat protective, and maybe that's been helpful as well. And of course, our population are in our study are patients who are in the clinical trial, and those usually are normal volunteers who normal in the fact they have macular degeneration, of course, but they tend to have maybe more health conscious. Maybe this is a little bit biased from that point of view, but I don't think so. I think that we really showed that the risk of macular degeneration is markedly delayed, and certainly if you have cataract and that needs to be done, I would not hesitate to get it done. But remember to go back to your doctor and say, I just had cataract surgery. Please make sure my macular degeneration hasn't progressed. And if it has, can we give some treatment? So I think that's the story. So I think it's good news for people with macular degeneration and cataract, because I think visual acuity in the end was actually very good.
I think that's such a comfort. Those are outstanding, results and great news. I've talked to so many people over the past, 10 or 15 years who have already had the onset of macular degeneration, and, they have their, quote unquote good eye, and so they've got one eye in treatment and one that the vision is still relatively, good, and they look to do anything to preserve their good eye and that vision in their good eye. And so I think this, the results that you're describing, I think are a huge comfort. And I want to reiterate and echo the suggestion that you brought up to mention to your retina doctor if you are in treatment, because they likely are not the ones who are performing the surgery. So closing that loop and making sure that all of your doctors have the best information possible and kind of executing your treatment plan is really important as well. Let's see. So if somebody already has macular degeneration and is receiving treatment, and these are questions that are coming in from the audience, can they still have cataract surgery, and how does that impact their AMD treatment? You kind of alluded to this, and I think closing the loop with the doctor. Is there anything you'd like to add to answer that question?
No, I don't think doctors are hesitant, even though you're in treatment and then you have a cataract. I think the doctor who's doing the injections and the retina doctor would be very grateful to have that cataract out so they can see your eye better, and they can still continue on with the treatment before and after your cataract surgery. So that doesn't interrupt it in any way. And in some ways, having that injection may actually help your retina. And so that's really important to do. I think I think again what Diana said is really key. That you're the key coordinator of this, making sure that the doctors know that what's happening with the doctors themselves, and often they do communicate with each other, but it's best time for you to make sure that they know what's going on, and clearly the retina doctor will not object to it, and they would be very grateful again to have that cataract out, probably just to make sure they can see well enough.
Absolutely. We hear a lot of discussion. In addition to this Bright Focus chat, we run a program called Macular Degeneration Community Circle, and it's essentially, a support group, but more than that, it's an opportunity for the participants to share stories with one another and their experiences both with the doctor, but also in managing the rest of life, lighting, and, social interaction and connection. And one of the big topics that always comes up is the type of cataract removal, whether it's surgical or laser. And I believe that only one of them is covered by Medicare. So aside from that barrier, is there a removal method that's preferable, or a surgical removal and laser relatively similar? Do you have thoughts on that one?
I think the key to remember is the cataract itself won't come out with laser. You could do a laser to open up the capsule, and that's important. So no matter what, you end up opening up the eye and removing it. And with or without laser, the laser costs a little bit more, and then there's another laser that comes on after that. So it gets a little confusing, but the laser makes it a perfect circle, so you can then remove everything out. And so with or without that is really something you have to discuss with your doctor. Sometimes it's cost involved, etc. But there's really no study suggesting one's way better than the other. So my father's had cataract surgery, and my brother's a cataract surgeon, and he doesn't always use a laser at all. In fact, he just uses sort of a handheld one. But what happens after that is they remove the cataract, but they leave a little bag behind. It's called a posterior capsule. What happens with that is that about 2 out of 5 people will actually get opacification in that, and then you would get what people call a second cataract, where your vision actually decreases again. And in that case, go to your doctor, and the doctor does a cataract, will be able to open it up with the laser with one, few spots that opens up, and it improves your vision. So the laser is done in multiple ways, and the different types of laser, of course. But for the lay public, they don't know the differences between them, and they have different purposes. But so that's where the whole idea of laser versus surgery, and then laser again after the cataract surgery is done. Does that make sense, Diane?
It does, and I'm just, as you're talking, I'm thinking, you know, we have so many discussions about treatments and injections and all of that, and I think the thing that we, or the idea or concept that we usually come around to collectively, you know, in settings with patients and internally as well, is not only is every person different, but every eye is different. So it's, again, going back to that conversation with your cataract surgeon and knowing what the best approach is specifically for your eye that's being operated on.
Well, you mentioned the support group, which I think is really important. Where we want to listen to our patients and hear what they have to say, because what they say is really important as well. And I think it's important for them to hear each other's stories as well. I mean, there's a real art and actually science where we actually talk about patient-related reported outcomes. We ask the patient how well do they do, what can they do, what, you know, with their function they have, what can they do, and those are things that I think make you understand, yeah, indeed, that really helped me or did not help me. So we can do only certain things, but functionally, I think the important thing is talking to your patient more than anything else.
Absolutely. And I think in forums, you know, like the community circle, it's a sharing of information, but it also builds a sense of empowerment, you know, and if there's someone that is a little bit further down the road and they figured out all the right questions to ask and had a great experience, you know, whether it's an AMD treatment or cataract surgery, if they're able to share that process and the questions that they ask their doctor and give that confidence to others to know, you know, that to a certain extent, you know, their health care is in their hands and the questions that they have are valid and worth answering when they're in that appointment with their doctor. So it really is a wonderful group. Okay, so switching gears regarding the new lens that is implanted, there are different. We have people asking different questions about that cataract lens that is inserted during surgery. Is there one that's better than other for those with macular degeneration?
Well, I don't think we've ever done a study looking at that, and I know that my friends who do cataract surgeries often say just the plain old ones do better for their macular degeneration patients because they don't really need a lot. But I think it depends on your vision. I think, again, it's very personal. It depends what your vision is. You have to talk to your doctor. There's, you know, these multifocal lens that you don't have to wear glasses to read and stuff. So it depends on your function and where you're at. So I think that's a really important question you talk to your own doctor about. And then obviously there's also cost involved in that because I think different lenses cost differently. But just a plain old basic lens seems to work well as well. So that's the only advice I have. And I don't do cataract surgery, so it would be important for you to see and really think of that. And at least the patients I've seen, more severe ones, tend to just go for the basic, and they seem to do quite well. So they do well with all the choices they do. So I think cataract surgery is quite an art, and the surgeons have a lot of control over that, and they can explain a lot more about what may or may not be good for your eye. Sure,
that makes sense. Okay, so I'm going to switch over. We have collected questions over the past couple of weeks while we were doing the registration, so I'm just going to kind of run through these questions at this point. So one listener was told that she has a PSC cataract in her eye that was caused by anti-VEGF injections, and was wondering, will it return after the surgery if they continue the injections? Does that make sense?
Yeah, well, once you've had your cataracts out, you wouldn't have to worry about the cataract developing at all. And it's sort of unusual to think that the anti-VEGF therapies have caused it, unless it really, needle actually penetrated that eye. And that can happen, to even the best of physicians, that can happen. And that doesn't mean that if they can remove the lens. But it's unlikely it will come back again. I think it should be pretty safe that the patient should maintain good vision with the cataract and as well as the macular degeneration being treated well.
Yeah, and not to mention if they were to cease the injection-based treatments, their macular degeneration would likely get worse as well.
Exactly. That part's a given. Unfortunately, we just can't have anything different, and those treatments are valuable, and they've helped a lot of patients.
Yeah, there was just a question about if supplements have any impact on cataracts or not. Are there any specific supplements that might help mediate the effect of cataracts?
Well, our study some errors at the very beginning in 1992 when we did that study. We thought that there were a lot of studies being done in cataract looking at vitamins, and the vitamins were being done for heart disease and cancer. And when we saw errors, we thought, well, we like to do some vitamins to see if it does affect the eye in any way. We all guessed and thought that the cataract would be really helped by the supplements. And lo and behold, it did not get help at all with the supplements in terms of the AREDS-1. In AREDS-2, which is a different study where everybody's given the AREDS supplement, but people were given either lutein or omega-3 fatty acids. Lutein is something that's found in green leafy vegetables, and kale, collard greens, spinach. And what happens with that was that if you look at people who don't eat any greens, like they never eat spinach, they never ate anything green, the lutein was somewhat helpful with their cataract. So it might have a small effect in people whose diet is very, very poor. But if your diet's pretty good, you don't need anything at all. And the other supplement data has shown no effect at all in supplements. So we generally don't give supplements for cataract, but the advice is to eat well. These days you've probably heard this phrase, food as medicine. That really is true. It's really important. We know that the diet is important for macular degeneration. And so I think it's really important to think about that. After our first study, we found out these green leafy vegetables are important. Eating fish twice a week is very important. So instead of a supplement, that those two things are really important for your eyes in general, for macular degeneration. And probably if you don't eat enough lutein, I think cataract could be an issue. So the long-winded answer is that supplements probably aren't that helpful, but the lutein may be helpful for those who have very poor diet. But instead of a poor diet, eat a good diet. That's good for your general health, for your cancer risk, for your heart risk. Cardiologists suggest you eat fish twice a week. So those are all, I think, important aspects that we have to remember that we are what we eat.
That's a wonderful reminder. And I'm not sure if this is has been studied, but I will ask this as my last question in case, and if it hasn't been studied, that's fine. Does cataract surgery affect wet and dry AMD differently? So are there unique concerns or considerations that one that has wet AMD might take into account versus dry AMD or geographic atrophy?
When we looked at our study, we looked for either wet or dry, and it didn't have any discrimination either one, and we didn't have any increased risk. So we don't think so. There was one study that had only 7 cases of dry AMD that went to geographic atrophy, but the numbers were so small, it's hard to tell that. I think one of the nicest study that's been done is one done in Australia, where they follow patients with one eye that had cataract surgery, the other eye did not. And they found really no difference again between cataract surgery did not increase your risk of cataract, of macular degeneration, and there wasn't any difference between wet or dry. So I don't think that's an issue that you have to worry about.
Thank you. And thank you for sharing so much helpful information with us today. This was really wonderful, and there are just so many questions that we get all the time. And so I know that what you've shared today is of comfort and definitely of use for the patients that we work with that will be talking with their doctors as they consider surgery. To our listeners, I hope you found today's chat helpful. Our next Macular Chat will be held on Wednesday, April 24th, and the topic is Resources to Help You Live Well with AMD. Dr. Chu, before we conclude, are there any final remarks that you'd like to share with our audience today?
No, I really don't have any more other than live well, and I want to thank you for having me, and I'd like to thank Bright Focus for all the support you give to all the research that's so crucial for so many people. That really helps all our patients with macular degeneration and other diseases that you support. So thank you very much, Diana.
Oh, thank you. We appreciate that very much. So thank you again to Dr. Chu and to our listeners for joining us today. This concludes the Bright Focus Macular Chat. Have a wonderful month.
The information provided in this recording is a public service of Bright Focus Foundation and is not intended to constitute medical advice. Please consult your physician for personalized medical, dietary, and/or exercise advice. Any medications or supplements should only be taken under medical supervision. Bright Focus Foundation does not endorse any medical products or therapies.